Hello everyone, how are you this evening? I hope this video doesn't end up too grainy. I'm actually just recording on my laptop at home because I was really keen to get some more information to you about your Merri Health Board presentation assessment. I did, as you know, I had a drop-in session on Monday afternoon, wasn't it? And had some students drop in at that point. I did record it, but I realised it was actually quite long because I was raving on a bit. And also I realised that when I looked at the recording, I saw a couple of students and I thought they may not want to be featuring on this short video. So what I've done instead is I thought I'd make a couple of shorter videos where I talk about the key information that I provided at that drop-in session. And remember, I've got a drop-in session again tomorrow afternoon if anybody would like to drop in at 3 o'clock. But I'll post a reminder about that on the discussion board. Because I am at home, you can probably hear my dachshunds barking in the background, so hopefully they'll be quiet. So the purpose, if you think about this assessment, so what I want to do this evening is just to give you some additional guidance re your Merri Health assessment. What I've done is I've written a whole lot of notes. I've got them sitting here on my screen because I realise some of you will prefer to listen to a video. Some of you will prefer just to read the information. So I'm going to give you both. So the purpose of this assessment is for you to think very laterally about a presentation for a board of directors. I sit on a couple of health boards. I've been a chair of a health service for a long time, and at every monthly meeting we have a member of staff do a presentation like this, or like you've been asked to do, to inform our governance roles. In this video, what I'm going to do is cover 3 really important tips about this assessment. So the first one is you need to brief, when you think about what the assessment is asking you to do, you need to brief the board of directors of Merri Health. It's really important to think about the audience. Check out the rubric. This assessment is not just an exercise in summarising the Sverrisson and Duckett report. You need to tailor your assessment to the audience. The main things to think about: what does a board of directors do? What are their roles and responsibilities? This is important in thinking about the types of information that would be important for their role. Think about the board's governance role. I tend to think about governance at 3 levels. So financial or corporate, clinical governance, and community. The board sets a strategic direction for the organisation. The CEO reports to the board. An operational function of the organisation is delegated to the CEO. Start with Googling about the role of boards and the different levels of governance, so you are super clear about what key information the board would be interested in. So who currently sits on the Merri Health Board? What is their background? Visit the Merri Health website and read about the directors so you are really clear about the audience. Now, I'm not going to provide you a link to where to find information about the directors because when you think about it, when you're out working, you'll need to put these presentations together yourself, so I want you to find that information. You will see that they have a diverse range of skills, with many not having any health background at all. So what will this mean as you tailor your presentation? The second main point I want you to think about is that the Sverrisson and Duckett report provides broad information on chronic conditions. The Board of Merri Health are focused on their community. Think about how you can contextualise the information for the board so it is relevant to their activity. Where is Merri Health located? What are the demographics of the Merri Health community? There is extensive data available at the local community level. A good place to start might be geographical profiles available from the Victorian State Government. There's really useful data on all Victorian communities, and in the notes that go with this short video is a link to that site to get you started. So identify the catchment of Merri Health. So work out, where does Merri Health sit in terms of local government areas, and look at the demographic data for the LGA. What does it tell you about the most likely chronic condition priority areas for the board? You might want to use some of this data in your presentation. Other useful sites for data include the Australian Bureau of Statistics, and I've popped in a link to that in the notes as well. Make sure you click on the Census tab on the Australian Bureau of Statistics site, and I've also put in a link to that, so to the Census tab. And on this site, there is really useful quick stats area data where you can search by postcode. What is the postcode of Merri Health, and what data can you find? What would the board find interesting from this site? What do primary health networks and primary care partnerships do? Can you find any community profile information from the PHN or PCP websites? So what you could do is figure out which catchment area does Merri Health sit in, and have a look around on the Primary Health Network site. Again, Google it. Use your skills that you've got to get as much information as you can to be able to tailor this presentation to be really fabulous. So the third key point I want to give you, so this video doesn't end up too long, is what is the current activity of Merri Health? You can get a lot of information from their website. Can you find their strategic plan and quality of care report? What sort of services do they offer? Is there evidence of interprofessional practice? Example, Sverrisson and Duckett highlight the importance of interprofessional practice. Is there evidence of integrated services on the Merri Health site or in any of their documents, and interprofessional practice? You might want to talk to the board, so you might want to put in place in your presentation about key points that are directly related to their organisation. i.e., one of the most important tips is you won't be able to cover every point from the Sverrisson and Duckett report. So what is likely to be most useful for that particular board in that particular community with that particular demographics and the health data that you can find about that particular community. As I said, I'm going to make a couple of these. If the quality of this ends up too bad because it is night time at home, then I'll re-record it. But I was really keen to get something up for you tonight. And then tomorrow I'll make you another short video that really gives you some key points about how you could lay your assessment out and approach it. So please let me know if this is helpful, because you know, I'm trying to put together what I think might be helpful, but I really need to hear from you about whether it is useful. I hope this stimulates lots of questions on the discussion board. And again, if you want to chat to me online outside those set times, because I noticed there are a couple of postings about the times not suiting some students, just let me know. I'm happy to have a chat to you either individually or via group. Zoom works really well. It worked well, really well when we used it earlier this week. So I hope that's helpful. I'll see you online tomorrow afternoon if you've got anything you'd like to chat about. And please do let me know how the subject's going. So yeah, that's gone for about 8 minutes. So that's a bit shorter than the other day when we were chatting. So hopefully I've condensed it. So take care. Have a great night. See ya.